Hello again, I'm Joel Barthelemy. When we talk about the need for changes in our healthcare system, we often forget that healthcare has been evolving for most of our lives. Taking you back to the 1950s, if you had to be transported to a hospital emergency room, you probably went there in the family sedan or in a hearse. About half the ambulance services at the time were run by morticians because they had the only vehicles with room for people to lie down. Until the 1960s and the founding of the American College of Emergency Physicians, there was little organization in the emergency rooms. They were typically run by junior doctors in training and other hospital staff physicians. When a specialist wasn't on duty, emergencies that needed a specific specialist were given to whatever physicians could be found, regardless of the expertise. In the 1970s, emergency medicine professionals began to realize that many of the people showing up in their emergency rooms had injuries and illnesses that were not life-threatening. So they started freestanding emergency rooms away from the hospitals. Today we call them urgent care centers or simply urgent cares. And many of them are part of large corporations. Like doctor offices, they used to be hidden away in office parks or medical buildings. Now they're out front in Walmarts, Costco's, and grocery stores. Urgent cares have a number of attractive points. They're convenient. They take walk-ins and they charge less than emergency rooms. For example, if you developed acute bronchitis, an emergency room visit could cost you and your healthcare plan a total of about $600 after you had spent hours in the waiting room. And I'm not going to bring up the screaming children or the people with potentially infectious diseases sharing that wonderful time with you. For the same ailment, you show up to an urgent care, see the doctor or nurse practitioner in less than a half hour, and pay about $127, or about 80% less than the ER. Another problem you would surely want to take care of is strep throat. The bill at an urgent care would set you back about $123. That would save you the wait and 77% of the $531 tab at an ER. Think of the number of parents who end up in an emergency room late at night because their child has a painful earache. The pain transfers to your wallet when you pay the $400 bill. The cost of taking care of an earache at an urgent care? About $110. Perhaps you or a family member would need to see a specialist. Well, this is an area that represents yet another change in the healthcare system. Urgent cares can now offer connected health to their walk-in patients. Our WallDoc telemedicine station can bring in a specialist via video conferencing. Mounted on a wall, it takes up less space than a bookshelf. And yet, the healthcare professional with the patient can utilize the same medical devices we offer on our larger mobile telemedicine stations if an examination is needed. Healthcare is changing, and at least some of it for the better. I'm Joel Barthelemy. If you have a comment, send it to me at Joel's blog, that's JOELSBLOG, @globalmed.com.